Hi, I'm David Dausey and welcome to the Dausey File. In this segment of the Dausey File, we're going to talk about fracking, and in particular fracking in Pennsylvania. On November 3rd, there was a news story out that there is a lawsuit in Pennsylvania from concerned homeowners who live close to a fracking site where they claim that there are toxic chemicals in their water that wasn't reported in a Pennsylvania official report on fracking. And so one of the things we have to ask ourselves at this point is, what is fracking and is it safe, and what are the public health consequences of fracking? There are a lot of governments around the world that are deciding whether or not they're going to allow fracking. It's been extremely controversial in Europe and now in the US. In the US, we have seen lots of potential positive things that could come out of fracking. One thing that could happen is it could help us with energy independence. Another thing that could happen is that it could potentially create new jobs and create a whole new industry for us here in the US. And so there are lots of positive things, but we also have many concerns about the environmental health consequences and the human health consequences that could be a result of fracking. And so let me tell you a little bit about some of the concerns we have. Fracking is a process by which we drill into shale and use pressurized water to try to extract natural gas or petroleum. In the process, we end up having to use millions of gallons of water, and in most instances that water becomes contaminated with the chemicals that are used in fracking. And so one question we have with fracking is, what do we do with all of those millions of gallons of contaminated water? Do we inject it back into the earth? How do we sort of properly take care of that water? Another thing that could potentially happen with fracking is that ground wells and other things could become contaminated with fracking chemicals. And one of the things we know right now is that we don't really know for sure what chemicals are being used in the fracking process. We know some of them, but not all of them. And so therefore we have to ask ourselves, what are we putting into the ground, and is there a potential that natural wells and other things could become disturbed and or polluted through the fracking process? And right now we just don't have enough data to suggest how big of a problem this could be, or what the environmental health consequences of the problem could be, or in fact what the human health consequences of this problem might be if water that humans are drinking becomes contaminated and they are unaware that the water becomes contaminated. Fracking also results in the potential for air pollution, and so what happens is that the fracking process releases methane into the air, and there are methane emissions associated with fracking. And so as we think about the fracking process, we have to say how much methane is being released, and does it result in human health consequences or human health problems. Right now, this is still in the air. There have been a lot of back and forth about this. It's very disputed about how much methane gets released into the air. There was a study out that said that a large amount of methane got released into the air. That was later disputed. People have been back and forth on this. Some of the people that live next to fracking wells have reported headaches and dizziness and all types of respiratory problems, and of course that is something that's also been disputed as well. So we're going back and forth on whether or not fracking results in significant air contamination and whether or not that air contamination results in human health consequences. One of the things we know for sure, though, is that fracking has not been studied extensively. The industry as well as the government have really blocked significant efforts to study the fracking process. There's been a lot of secrecy around the studies that have been done, and there's a lot of confusion, and the general public is largely unaware in terms of what's involved in fracking and what concerns we might have with the fracking process. And so I would say, and I would argue, that basically all fracking at this point should be considered experimental, and that people that live close to fracking sites have every right to be concerned about fracking and whether or not it might result in health consequences, and they should actually demand that more research is done and that we slow the process of fracking. We shouldn't let our desire to become energy independent and our desire for corporate profits and our desire for jobs overrun our concerns over public health and keeping the public safe. And so I would argue that in states, particularly like Pennsylvania, where we've opened the doors and we've said, hey, we're going to allow fracking in this state, these are all states that engage in what I'm going to refer to as experimental fracking. We have not proven yet that the fracking that is being done is safe for the environment or safe for human health. And until we do that, until we prove it, until we have rigorous scientific research to prove that the public is safe through this fracking process, we cannot guarantee that fracking is going to result in no environmental consequences and no human health consequences. Thank you for watching the Dausey File. We look forward to seeing you next time.